we'll talk about isotretinoin or Accutane, which is a miracle medication for acne that has been unfortunately severely restricted for prescription in the United States and dispensing, obviously, throughout the federal United States. And it's also had a very bad reputation throughout the world, but the United States is very special in the sense that it restricts dispensing of this medication through a federally mandated system called iPledge. So what is isotretinoin? Well, isotretinoin is a molecule that's related to vitamin A. It is a synthetic medication that's been around for probably close to 50 years, and it's been known to treat acne in a very special way. What's special about isotretinoin? Well, first and foremost, it is the only medication we have in our arsenal that could potentially cure your acne. You heard it right. This medication could lead to a very long-term remission in your acne, meaning disappearance of the pimples for months, years, and in some cases, in many cases in fact, it can lead to the resolution of your acne for the rest of your life. And that is the case with many people. It is not a rare occurrence for someone to finish or complete their Accutane treatment and then not have acne for the rest of their lives, or very mild and manageable acne that they can get by either not treating at all or treating with something very limited, if that. So it is a miracle medication. The other thing about isotretinoin, adding to the cost effectiveness of this medication, is that the treatment with Accutane is actually very nicely and tightly bound, meaning it is a short-term treatment for about 5 to 6 months in most cases, at the end of which, again, most people will see a remission of their acne and in many cases a cure of their acne for the rest of their lives. So this is a highly effective medication. Cost effectiveness is through the roof, because if you're that person who completed the course of Accutane within 5 to 6 months and has cleared their acne for the rest of their lives, then you've saved yourself God knows how many office visits to the dermatologist or other doctors. God knows how many prescriptions that you would have had to have filled and used. God knows how much heartache that's involved with having another pimple and more acne and more of this and more of that. Visits to the cosmetologist, visits to this, visits to that, applying makeup, all these things that compound and pile on because you have acne and isotretinoin can fix. So clearly, it is a very effective, very important medication to use, and here we are restricting its dispensing, which is absolutely bonkers. So what is the reason behind restricting the prescription of isotretinoin? Well, let's get to the bottom line. The bottom line is that it's arbitrary, right? The bottom line is that it is arbitrary. This medication does have associated serious side effects, although they are exceptionally rare, and I'll address them in a moment. That being said, there are many medications in our arsenal, including medications that are used to treat acne, like antibiotics, birth control pills, and other medications that have severe side effects associated with them, and in many cases more frequent and more common than isotretinoin, and yet they're not as restricted for its prescription and don't have that giant shadow over them as isotretinoin does, which is very interesting and again seems completely arbitrary. But here's the deal with isotretinoin. So isotretinoin has a number of serious side effects that have been associated with it. However, many of them are actually not statistically significantly associated with isotretinoin. But let's look at the one side effect that is clearly a result of taking isotretinoin, and that is birth defects. So if you're a female of childbearing age, you do not want to be on isotretinoin while being pregnant, because if you are pregnant and taking isotretinoin, you will surely experience birth defects in your fetus. Your baby will come out deformed, and that is a certainty. So we do everything in our power to counsel patients, to counsel women who are on the medication not to become pregnant. In many cases, put them on contraceptive methods so they cannot become pregnant while on this medication. And in many cases, females declare abstinence and are not going to become pregnant while taking this medication. You can become pregnant safely after having completed the treatment and having waited a few weeks after the treatment, and there's no problem there. There are no long-term side effects on female fertility, and in fact on male fertility or any kind of fertility. This medication does not involve any side effects on fertility per se, but it does cause birth defects if you are pregnant while taking this medication. That is the one short side effect that people who are on this medication and are pregnant will run into. Now, there are other side effects that have been associated with this medication in urban legends and in popular culture. Those side effects are actually not statistically significantly associated with isotretinoin. Those side effects include anxiety, depression, suicide, and then there are the other side effects that people talk about, such as inflammatory bowel disease, which, again, much like depression and suicide, has not been shown to be statistically significantly related to taking isotretinoin. There is, however, a subset of patients that can become anxious or jittery while taking isotretinoin. Those patients I counsel, and I've seen less than a handful of them throughout the years, having used isotretinoin on thousands of people. I can tell you that those patients are farther and fewer apart. However, I do counsel people, if you do become jittery on this medication, if you develop thin skin while on this medication, let me know so we can adjust and address the issue, maybe adjust the dose, maybe take you off the medication altogether, really depending on the set of circumstances in particular. Now, as far as side effects on Accutane, there are some more common side effects that can be serious, however, they're largely reversible. And that is transaminitis, which is a form of liver irritation. We do recommend for patients not to drink excessively while on isotretinoin. You can drink some alcohol, but obviously don't overdo it, don't binge drink, because that can actually cause liver irritation in and of itself. And in combination with the isotretinoin, they can synergize and together compound to create more liver damage. And that can show up on your blood work, it can make your doctor worry, it can make you worry, and eventually the medication will have to be stopped if the side effects or the liver irritation is too severe and does not go down with decreasing the dose of the medication. Now, the one side effect that everybody runs into with isotretinoin is dryness of the skin. In many cases, there is dryness of the nasal mucosa, meaning the inside of the nose or the nostrils. Sometimes that could lead to nasal bleeds. In some cases, you get dry lips. That is a very common side effect again. And the interesting thing about isotretinoin is this side effect in particular is actually usually very bearable. People actually tolerate it extremely well, and all it comes down to is what to do with that side effect. And that side effect causes, by the way, in addition to just plain dryness, that can actually cause to acne scarring, which isotretinoin is supposed to treat, to become more apparent or more red because the skin is drier, it's more sensitive. And isotretinoin can also lead to a little bit of sun sensitivity, not big time, but a little bit of sun sensitivity. And the combination of the dry skin, sensitive skin, and the sensitivity to sunlight can lead to reddening of those areas that are already worked up, which are the scarred and inflamed areas. So that's something that needs to be addressed. The best way to address it is, first of all, you know me, do no harm. Do not scrub silly. Do not use soap. Do not use hot water. Do not use anything to cleanse. Do not use anything to scrub away at the skin. Leave the skin alone. Use lukewarm water to wash the skin. Use a little bit of moisturizer. Best moisturizers out there. Petroleum jelly, my Creamy Carnauba moisturizing balm. You can use either one of those without fear of occluding the pores. Use a very small amount of the moisturizer, like a drop size amount over the entire face. Or if you're moisturizing the hands, the arms, and the shins, moisturize the entire limb, so you're not getting too greasy, and the moisturizer is not staining your clothes or anything like that. Moisturize however many times throughout the day to address dryness. And everybody's got their own rhythm, and the skin is getting dry at different rates. Another thing to consider if you have nasal bleeds is to use a Q-tip and apply a little bit of Vaseline or the shea butter balm to the inside of the nostril to protect the inside of the nostril and moisturize it so it's not as sensitive, it's not as fragile, and it doesn't bleed as easily. You can also use artificial tears for the eyes if your eyes become dry. And then there's another side effect that, again, extremely rare, but can happen in some cases, and again is reversible, and that is decrease in night vision. That's due to the effects of isotretinoin on metabolism of rhodopsin, which is a molecule that enables night vision and visual discernment. So, bottom line for isotretinoin, extremely cost-effective medication. In fact, it is the most cost-effective medication that we have in our arsenal to treat acne. It is a medication that can address chronic acne, no matter what the severity of the condition is, by the way, from mild to moderate through severe. No no matter what the severity is, it will address your condition and will resolve, in most cases, your acne for a very long period of time or for the rest of your life. The treatment, the length of the treatment is very well defined. It's 5 to 6 months in most cases. Some cases go a little bit longer, really depending on the person, but most cases 5 to 6 months. And that's no acne for a very long period of time or for the rest of your life. And another side benefit of isotretinoin is that it does actually decrease and diminish acne-related scarring. A lot of scarring goes away by the end of the treatment. So by the time you're done taking isotretinoin and you've completed your treatment, you're acne-free, you may as well be scarring-free, or your scars will have diminished to such an extent that you will likely need very little work done to fix those scars. So as I mentioned from the beginning of the video, isotretinoin is an extremely cost-effective medication. It has many great benefits that no other medication in the acne arsenal has. However, it has a few urban legend associated side effects that have kind of made it an arbitrary target of the bureaucracy and made it very difficult to prescribe for many physicians and patients in the United States. That is an unfortunate situation. However, if you are a person who needs isotretinoin, who either has chronic and unrelenting acne or has severe and scarring acne, those cases would clearly benefit from isotretinoin, and that begs the question, are you an eligible candidate to be on this medication? So what do I usually do before putting someone on the medication? So obviously I make sure if they're a female of childbearing age, I make sure that they're not planning on becoming pregnant anytime soon. If they are of childbearing age, we have to, and we're mandated by the government to make sure that they're either on 2 modes of contraception or they're abstinent for the duration of the treatment. I know it's extremely intrusive. That is the federal government at work for you. It is what it is. We have to do that per the federal government so we can actually dispense the medication to the rightful patient. Now, another thing to make sure is that you are not a very big drinker of alcohol. And if you are, you need to tone it down for the duration of the treatment so you don't mess up our blood work and you don't put your liver at risk and your life at risk doing that. Now, I do ask people about inflammatory bowel disease, even though the significance has not been statistically significant there. That being said, that is something that is out there in the public discourse. You have to be careful about dispensing it to a person who has inflammatory bowel disease. So I always ask in advance. I would not prescribe it to somebody who has inflammatory bowel disease because of the suspicion that it might flare up their condition. I don't think that it causes it, but it might flare up the condition, so we make sure that that's not the case. And then again, we worry about people who are severely depressed and uncontrollably depressed and anxious. That is an extremely, extremely rare and small group of patients, and we do make every effort to obviously get their symptoms under control so we can, in some cases, prescribe isotretinoin and improve the quality of their life. If somebody has severe mental health issues, I do make sure that they see a psychologist and a psychiatrist to make sure that they're actually safe to take the medication. We can work it out in many cases. In cases where the condition is not well under control, it's probably in the patient's best interest to hold off for the time being, get their problems under control there, and come back with everything has been smoothened out and their life and mental health is well balanced. So those are the criteria for putting somebody on isotretinoin and prescribing this medication. The course of the treatment is usually 5 to 6 months, as I said, and it's an extremely effective medication. I highly recommend it to improve your quality of life, get you off the acne medication carousel, so to speak, and get your life back and get your freedom back so you don't have to rely on the doctor visits, on the prescription medications, and you don't have to rely on the skincare industry to maintain your good looks and your peace of mind. Well, thank you very much for watching this video. If you got some benefit from it, please hit the like and subscribe button to support my work. More awesome content coming your way. Thank you again for watching, and God bless.
Ryan Little.